Hello, my name is Judith. Welcome to Sinla Podcast. Today we'll be having an interesting, a very amazing now friend,
Judith.
known online as the noisy pediatrician, to talk about a very important topic. Okay,
Yeah.
and this is really his specialty.
Mm.
But before we move on, everybody knows you as a noisy pediatrician.
Yes.
And I'm sure they're going to be shocked by the time they find out what your name is. So can you just give us a brief introduction? Who is the noisy pediatrician?
Okay, so the noisy Naija pediatrician.
Noisy Naija pediatrician,
Yes, is Dr. Ayodele Rena. That's me. And I'm a consultant pediatrician, meaning that I'm bold because I've read a lot of books.
That's an interesting way to say it.
Yes, and I'm also a content creator.
Okay, we know that.
Yes, I offer free health education in an entertaining, relaxing, non-threatening way to parents.
I don't know about the non-threatening.
Parents, caregivers, and anybody generally who is involved with the care of children. And yes, I'm an all-round happy fellow.
That's for sure. We can attest to that.
Right.
So, how many years now with children pediatrics?
So I started residency in Luth in 2012. So
Wow.
as of last year, I was 10 years taking care of children in one capacity or the other. Yes.
And the fact that just when you're thinking, oh, this set of children, I'm doing, you have another. I can imagine. Like a mom, there are phases you're going through because you are telling yourself, this is a phase.
Yes.
It will pass.
Yes, indeed.
And you've done it for 10 years.
Yes, 10 years.
With good authority, we can say that children, you understand children.
I understand them. They are magical.
That's fantastic. So today we're talking about something interesting and something that I feel like we're not maximizing in our country, which is newborn screening.
Yeah.
As a pediatrician, we believe you're the best person to speak to this. Can you talk to us about newborn screening? What is newborn screening?
Very important topic, Judith, because newborn screening is the process by which babies in the first month of life are tested to see if they have any conditions which could be dangerous or which will have significant adverse outcomes on their health and on their lives and the lives of their parents before the disease begins to manifest. So essentially what you're trying to do is that you're trying to catch them before these symptoms begin to show.
Wow. So it sounds like a very important thing to do. But what are the trends? You've worked for 10 years, you've worked with children. What's the trend in Nigeria? What's the adoption like? Are people seeing the need to really do these newborn screening tests? And are they even recommended by you, by the doctors?
So let's look at the global picture first. So in a lot of countries that are developed, you do find that universal newborn screening is actually free and it's recommended. It's not mandatory, but a lot of these jurisdictions advise that parents actually do these screenings. And that's because if you detect some of these diseases, some sort of preventive therapies can be instituted that will prevent progression of the disease. But when you come down here to Nigeria, one, it isn't even recommended by physicians. We know that it should be done and it can be done, but it isn't recommended for a lot of reasons, because one, we feel like, the test might not be available. Two, it might not be affordable. And then three, maybe diseases are not as common as we think they are. But that's perhaps because we're not looking for it. And maybe if we did, we might actually find that they are more common than we think they are.
So from an informed perspective, are these disease patterns as common as it presents in other countries? Okay,
so one of the things that we need to look at is the peculiarity of our environment. So, for instance, there's a specific condition that we call glucose-6 dehydrogenase deficiency. It causes very severe jaundice in babies. In some places, it is routinely screened for. In Nigeria, it is not routinely screened for. But some researchers have found out that glucose-6 phosphate dehydrogenase deficiency is very common in Nigeria.
Wow.
Yes, so this means that we're probably missing quite a lot of them. So until we begin to actually start a universal screening program where we are finding babies and documenting what the rates of these diseases are, we'll never know which are common to us and which are absent from us. There are some that are definitely not even present in our environment. So, for instance, cystic fibrosis, which is a disease that actually causes some difficulty with clearing mucus and breathing from the lungs. That does not exist in Blacks as far as we know. So, of course, one wouldn't recommend that screening is done here in Nigeria. But some others, that might exist with us, but we don't know, should actually be tested for.
So from what I hear from you, because most of the innovations or most of the recommendations will come with an or prior information or data.
Yes.
Data-driven, right?
Data-driven, exactly.
So now we may not even be in a position to receive the advice or action on certain things because currently there are no documentation. So you've worked in the tertiary institution, tertiary hospitals. Are there documentation of the disease patterns presenting in children?
So what happens usually is that we would try to do the diagnostic tests based on the symptoms.
Based on. So more like a reactive approach, not a proactive
exactly.
approach.
So after the child has developed the symptoms, then we begin to look for the disease condition. And so in that way, we can document that, so this percentage of newborn babies actually have congenital hypothyroidism. But we might be missing some of these babies because sometimes they might go home because of the way our healthcare system is, where it's difficult to follow patients up and call and ask what the problems might be. Some of them don't come back to us with the specific complaints, and some of these babies are lost to follow up, and some of them actually even die, and we end up missing these babies. So again, there are challenges with, our healthcare milieu and our record keeping and even health-seeking behavior in the parents.
Well, that's some food for thought, because ideally, I feel like, or what do you think? I feel like every tertiary hospital should be able to record disease patterns because they should form bodies that could advise government to decide on next steps with medical intervention. Since we are having a reactive approach, so that we can say, okay, based on the kind of patterns we're seeing, we recommend that children in this age category should do this kind of testing. So now, as it is, so who should do newborn screening? Who should have newborn screening done?
So every newborn should actually have a newborn screening done. That is the ideal. Yes, that is the ideal. Every newborn. Now, our priorities, in terms of what we should be looking for, unfortunately, might not be the same as that of Western countries because up to 70% of births in Nigeria actually take place at home.
Wow, 70%? That's a huge number.
Yes, if you think about the large number of people living in the rural areas, 70% of the births actually take place at home without the presence of a skilled healthcare professional. And, this means that, so even the basic newborn care is not administered to newborns in Nigeria. So unfortunately, our priorities, really in terms of healthcare and newborn survival are geared towards making sure that newborns survive, making sure that newborns get even the most basic care, like eye care, cord care, helping them breathe when they arrive. And so on the scale of preference and in terms of what we need to prioritize, newborn screening for metabolic diseases, unfortunately, isn't quite high up because we're still even trying to get our newborns to even survive.
I can imagine.
But for those, and in those places where, newborn survival isn't such a problem, then I think newborn screening really needs to be presented to, such parents so that they know that, we can detect some of these diseases.
Because, the way it sounds right now, it feels like newborn screening is like an elite thing. It's something that parents who feel like they have money that they are not using can decide to do for their children. And then what do you think is the place of hospitals in ensuring that newborn screening is done? Because obviously, I cannot put to bed and then wake up and say, I remember when I had for the two kids I've had, no doctor came, and of course I gave birth in what you classify as almost an elite hospital. And I never had a doctor come to me to say, oh, Judith, you need to do certain series of tests. I know that immediately they had to administer the vaccines that were appropriate and do the certain blood tests for genotype and blood group, and then for jaundice. So aside that, there was no recommendation. In fact, they let it be that, okay, maybe there was a recommendation and then maybe I didn't want to, optional. So the option was never even presented. At all. So do you think that hospitals need to do better, or is it that maybe the coalition of pediatricians needs to come sit together and agree that every child that is giving birth to do certain tests based on the disease patterns that they've seen in the course of treating children?
I think it's a very important question. Now, the professional body for pediatricians in Nigeria, the Pediatric Association of Nigeria,
Yes.
and unfortunately, I'm not aware if there are guidelines in terms of what newborn screening should look like or what the recommendations might be, or even if they exist.
Okay.
And even if they don't, unfortunately, individual hospitals need to consider things like the expertise, if the expertise is available for such newborn screenings to be done, accurately interpreted, and presented to the parents. They need to consider the costs of doing this, even though at the end of the day, perhaps most parents would be willing to bear the cost if they can.
Yeah.
I'm not aware if, because a lot of people in those kinds of settings, are in managed care where HMOs are involved.
Exactly. And
are the HMOs willing
to
yes, are the HMOs willing to cover for, screening procedures? So if you look at a lot of HMOs, they will have, things like, breast screening, cervical cancer screening as part of packages, but I haven't seen any HMO where newborn screening is part of their package, So I think those are some of the barriers that, private hospitals might encounter in trying to, institute newborn screening.
So just to give our viewers the context, what are the risks for not doing this carrying out a newborn screening and the effect ultimately has on the parents? Because, when you're saying, oh, newborns, it sounds very nice to say. Can you mention some of the diseases so that, because when I say newborn screen, it sounds like something that's
very esoteric.
That's nice and fancy.
Yes.
So, parents, you go to meetings and be like, so I remember I went for a Parents-Teacher Association meeting and then someone was just throwing words around. So I'm doing speech therapy for my daughter. She's just 2 and she's not talking. So I'm seeing a therapist. So newborn screen sounds like something that people can gather. Mothers, we're extra. Like, so we just did a newborn screening, to be sure that everything checks out.
Interesting.
So just to put it to context, what are some of these newborn diseases?
Okay.
So that parents can know how serious these things are. What they could,
Okay, so there's newborn screening for sickle cell disease, congenital hypothyroidism, which is a condition in which the thyroid gland isn't working very well and it causes mental retardation in such babies. Then there's phenylketonuria, which is where a particular amino acid, phenylalanine, is not processed properly, and it can cause also mental retardation, liver problems. There's galactosemia, cystic fibrosis, glucose-6-phosphate dehydrogenase deficiency. It's a big. Unfortunately, there's no time in this particular episode to explain everything. But just what underlies all of them is the idea that if those diseases don't end up, if you don't end up diagnosing those conditions on time, the quality of life of such babies are significantly altered, especially with regards to mental health and mental retardation, liver function, and some of them actually don't even survive beyond their second birthday. Some will actually not survive beyond the first year of life, with some of those conditions.
And these are not things that you can actually look at the child and say, so it looks like cystic fibrosis.
No, unfortunately, you can't. Without screening programs, the first time you know that a child has that condition is probably when the condition is quite, advanced and quite severe.
That's not good.
And that's not good. Yes.
So it's like one of those, they show for face.
No, they show for face, exactly. And so the thing about it is that so you want to kind of like detect them with the screening program and then institute preventive measures, whether it's eliminating milk from the diet in children who have galactosemia, or whether it is or lactose specifically, not milk, lactose. Or whether it is eliminating foods that have phenylalanine in children who have phenylketonuria, so that that you are able to preempt the disease progression and stop it by instituting preventive measures.
This is something. That's some serious thing. I don't want anybody I know to have any of those things.
Crazy,
they are really strong names. And then, and when it comes to managed care, let's assume, because sometimes the severity. I remember when we're driving campaign for liver function testing, and then apparently it's driven home now because people know that you could actually spend a certain amount of up to say 4,000 to 5,000 to screen for a liver issue, but when it comes to treatment, you're talking millions.
Millions.
So, what are the effects of non-treatment or not doing any of these screening tests on parents and finance?
Unfortunately, the problem with some of these conditions is that they're actually incurable.
Wow.
So yes.
So it's not even a money thing. Like
so
if I have money,
thing.
I can't throw money on it.
Yes, you can't. So things like cystic fibrosis are incurable. Things like galactosemia are absolutely incurable. And with things like congenital hypothyroidism, the mental retardation is actually irreversible.
Wow.
And so you kind of don't even want the disease to manifest at all. You kind of don't even want it to happen to the child. I mean, they already have this disease, but you kind of don't want it to progress, further, because they're incurable. So no matter, it doesn't, regardless of the amount of money you've got, there simply isn't any remedy, to those conditions.
That's a hard one to swallow, because I mean, like if it's something that you could actually throw money on, you could say, okay, fine, if it develops it, I can put in some money and it's fixed.
A lot of those things are in the genes, so there are gene errors that simply cannot be erased from the person's makeup.
Wow. I mean, that's something to think about, guys. So what's your recommendation now to parents and to medical facilities?
So my recommendation really, and I believe that, this is something that has been in practice for years, in the developed countries. Even though you might say that some of these diseases are rare, you kind of don't even want any child to come down with that, because for that one child, that is 100% for that family. Yeah, they don't have this.
Yes, there's no statistics.
There's no statistics for that one precious child, and so you kind of want to do the screening for each and every child, so that even if out of 100 tests that you do, you detect 2, you are satisfied that you have saved 2 lives.
Exactly.
And those are valuable lives that really can
to that family. It's not 2 lives. It's the only one.
Yes, and on the long run, to the nation, they can be the next Judith with the podcast, or Dr. Rena with the information
and the dance.
So these are children that potentially could actually change and revolutionize something, later in the future, to help the nation move forward. So they are precious in every regard.
I think, and there's a role that parents has to play. I remember when I was at the hospital as well, when they had discharged us we've done the jaundice testing. So of course they always say that mothers are always the first doctors. I don't know if that's the right thing to say.
I agree.
For their children. So I know at a point I had to ask for a repeat of the test. To just be sure. So I feel like the parents has a key role. The mothers has a key role to play in this, such that even if your doctor is not recommending, you can actually ask your doctors and then some laboratories who are trying to do innovative testing and who are doing this kind of testing.
I do know. Should I say it?
Say one.
Say one. SynLab. So I do know that SynLab does testing for genetic screening for genetic diseases, screening for those. Again, I think if universal screening is instituted, and we're getting large enough numbers doing universal newborn screening, then the costs can also come down. Exactly. Yes, because it's not cheap to run such tests. Yes. But if you had the large numbers, then perhaps it would actually be a bit more. Yes,
so one final word of advice for doctors, for different segments. I want one final word of advice for government, for practitioners, that's doctors and hospitals, and for parents.
So for government, I understand that finances are not limitless, and that priorities need to be organized such that you deal with the most urgent problems urgently. But what the government can do is recommend it, and then where for facilities that can do it, then subsidize the cost. Yes, don't you have to pay for everything, just subsidize.
That's good for government.
So. Yes. Then for hospitals, and I'm going to talk to the hospitals and the HMOs. So for hospitals and insurance providers, please educate parents on the existence of newborn screening. HMOs, subsidize it as well, so that the parents can actually participate in it. For parents, educate yourself.
Yes.
Get information about newborn screening. If there is a history of genetic disease in your family, or you've had a newborn demise, a newborn death, a death of a newborn, or even a child less than 1 year of age from an unknown cause, then it's important that for subsequent children, you try to get newborn screening done, because it's possible that that there was a genetic problem that was not detected and that perhaps you could prevent, from happening to subsequent babies.
Thank you so much. I mean, you've done justice to this topic. And I also think that people like you who are, your reward is in heaven, because obviously you've saved a lot of lives. I mean, sometimes when I look at your page and look at the things that the blunders we parents, and it's from a place of care.
It is.
And then we are killing the children. So I also think that a segment which that is important are doctors who are educating actively on social media, because people are the ones that drive this awareness, of course, through the selfless service you do online. So I want to thank people like you.
Thank you.
For making we mothers do better. I want to thank
you.
Organizations who are also working hard to ensure that these tests are accessible and available with quality as well. Thank you so much.
Thank you so much, Judith, for having me. Thank you, Sinla Podcast. I'll be back.
We are going to adopt you. Thank you so much. It's been a pleasure.
Thank you. Pleasure
thank you, Dr. Rina.
Thank you so much for having me.
Thank you, the noisy pediatrician. Thank you so much.
All right. Bye, guys.
Bye, guys.